Good morning and welcome to today's meeting of the Adult Health and Social Care Policy Committee. My name is Councillor Argencio and I chair this committee. Thank you for attending, whether in person or via our webcast. The meeting today is open to the public and the meeting will be webcast and the recording will be available for people to view later through the Council's website. It is also possible the Sheffield Live TV will record and rebroadcast this meeting. We have received a public question today, so we're going to do that when it comes to that point in the agenda. Please may I request that mobile phones and other such equipment are switched to silent mode so as not to disturb the conduct of the meeting. There is no fire test for today, so if there is an emergency, please take instructions from the Town Hall staff, and the assembly point is Tudor Square. I will now ask colleagues to introduce themselves, and I'm going to start with councillors, and I will start on my left.
Good morning, I'm Laura McLean, I'm councillor for Walkley.
Morning, Councillor Martin Phipps for City Ward.
Morning, Councillor Ruth Milsom. I'm in Crooks and Crosspool Ward and Labour Group spokesperson for this committee.
I'm Councillor Mick Rooney. I represent Woodhouse Ward, and for once I'm on time, and I've got my security badge as well. Hey.
Good morning, I'm Councillor Steve Ayres, Councillor for Graves Park Ward.
Good morning, Councillor Sophie Thornton, Councillor for Beechif and Greenall Ward and Deputy Chair of the Policy Committee.
Hi everyone, I'm Councillor Dr. Will Sappo, newly elected Councillor for Stannington Ward.
And welcome to the committee. I believe this might be your first meeting. So welcome to Sheffield City Council. We'll have a chat later. And Councillor Diane Hurst is also here. She just popped up to get a pen, so she should be here momentarily. So apologies for absence. We've received apologies from Councillor Grokert, who's been substituted by Councillor Hurst. The exclusion of press and public. There are no exclusion of press and public today on any of our items. And item 3, declaration of interests. Is there anybody who needs to declare an interest on any item on the agenda today? Brilliant. And so we go on to item 4, minutes of the previous meeting. These are on page 11 of your pack. I had a look yesterday again and I couldn't see anything wrong with it. So are people happy with page 11, 12, 13, 14, 15, 16, 17, 18 and 19? I couldn't see any matter arising unless anybody can tell me that I'm wrong. Brilliant. So are those approved? There's a record of last meetings. Thank you. And we go on to public questions and petitions. And today we have Mr. Lennox, who has come to ask a public question.
Good morning all. What has recently changed or will be introduced in 2024 in the southwest of the city in respect of care and wellbeing services? There have been a number of City Council reports referring to a transformation in such matters. For example, hospital discharge and urgent care plans, preventative health care services, place-based initiatives to improve health and well-being, integrated pathways of care, team around the person, primary care networks, and pathways for support and information platforms about health and care. Will we live longer and better as a result of these? And how will local people be engaged in service development?
Thank you so much for your question. And first of all, I want to apologise for the fact that there's been some kind of secretarial problems, and the meeting was supposed to be arranged between yourself, Councillor Sangar for the South LAC, and the Director of Public Health, and that's not happened, as I understand. So actually, I'm going to ask our Executive Director to give you a part answer, and then I'm going to ensure that that meeting is arranged, and I will attend as well, just to make sure, you know, that we all have, we all kind of agreed on a way forward. Thanks, Alexis.
First of all, I just want to say thank you very much for your question. Extremely helpful and absolutely committed to improving the lives and outcomes of our individuals across the city. In response to your question, what my office will do is arrange a meeting between Councillor Angela Argenzo, Councillor Sanger, Greg Fell, who's the Director of Public Health, and myself, and my office will arrange that meeting, and we could talk through the issues you've raised, but also give assurances as to the way forward. And I really look forward to meeting with you, and also I want to thank you for your question, and I'm really delighted as to the opportunity to discuss that with you.
Thank you. Thank you. Item 6 on our agenda is appointment of subcommittees. So, so it's just to note that in accordance with the authority given to the committee at the meeting held on the 14th of June 2023, the monitoring officer, in consultation with the relevant political group whip, have authorised the appointment of Councillor Gail Smith as a substitute member of the Health Scrutiny Sub-Committee with effect from the 6th of December 2023. This may change because we have a changeover between Councillor Smith and Councillor Sapwell, who's been appointed to this committee. And I just publicly want to thank Councillor Smith, who's been really engaged with the meetings and the briefings over the past 8 months. You know, I just want to put that on record, and welcome to Councillor Sapwell. We'll do all the, you know, kind of training and briefings so that you can brought up to speed with the committee. Okay, and item 7 is members' questions. This is an item where members of the committee can ask questions of the chair, and we have not received any this time, but remember you can ask questions, and we'll, you know, Councillor Sapwell, we will let you know what the kind of arrangements for those are. So item 8 on page 21 of your pack is the work programme. I just want to remind office members that the work programme, obviously we've got just one meeting left for this municipal year, but as always the work programme is a draft work programme, because sometimes items get moved because of timings or other things get added to it. So for example, today we've got the direct payments item that was supposed to come to us last month, and it's been moved to this one. So are there any kind of issues or things that people want to raise about the work programme? Are people happy with the work programme? Can we approve it? I just have one thing. I would like to just ensure that we any action that comes particularly from the climate statement that need to go into work programme, they worked in, but we can talk about that later on the agenda. So we are now on to item 9, hospital discharge and urgent care delivery plan update, and this is on page 39 of the report, and I believe that, oh, it's, so we have Kelly and Catherine. and Janet. 3 for the price of 1. There we are. Thank you.
Hello, good morning. My name is Kelly Siddons and I'm the Assistant Director for Living and Ageing Well Short-Term Services.
Hi, I'm Catherine Bunting and I'm the Assistant Director for Commissioning and Partnerships.
Janet Kerr, I'm Operations Director in Adult Care and Wellbeing.
Okay, so the documentation within the pack consists of the report that I'm just going to give a brief overview of. So the main purpose of the paper is just to update committee on operational progress around our discharge ambitions, and since the last report, which was delivered to committee in June 2023, ahead of myself. So the recommendations within the report are an update on current performance around hospital discharge and some of our avoidance work, to approve the commissioning strategy around a specific home care contract for discharge, and to update on the delivery and our plan for the next 6 months, of which we will then come back to committee to give a further update. So within the report, we've been clear on what our ambitions are for the people of Sheffield, and we are really passionate about making sure that our vision is that we deliver a really person-centred approach to hospital discharge specifically. And we really want to make that discharge personal, involving people in decisions appropriate to their care and, wherever possible, to their return home. We have changed and made some specific changes to the way that we report on our discharges in Sheffield, and that is now in line with the national indicators around our pathways. I'm pleased to report that in Sheffield we do perform particularly well, with 95% of people returning home. We are also working now across a joint leadership approach within the system, and we've also got some dedicated programme support, which is really helpful in us identifying some of the short, medium and longer term pieces of work that will help us to improve that process and the experience for local people. So since the last report in June 2023, we've actually discharged around 2,500 people. That's quite a significant number, and I think on average it's about 5,000 people per year. So again, we compare their really high numbers in comparison to similar other local authorities. I think one of the other things that I would just highlight is, again, we also really focus on getting people to return home wherever possible, and prevention and early intervention, and really working with people to move further towards that discharge to assess model as set out in our ambition is really one of our key priorities as we continue to move forward. So we continue to perform really well against our other indicators. So the number of people that remain home, 91 days following discharge, is really positive against our neighbours across Yorkshire and Humber. And just to pick up that, again, you know, the work that we're doing from an integration point of view is we've set out more recently a really clear integrated criteria about when people particularly go home, so how their care needs can best be met. And that work's filtered through into the way that we are really utilising our home care contract in Sheffield, which I guess leads us on to the next stage of the report. So I'll hand over to Catherine.
Thanks. So in the recommendations box, you'll see we're asking committee for approval for a discharge contract. We've worked really closely with our independent sector providers in home care in this work over the last 6 months, and they've helped us to implement new ways of working, and they've worked in partnership with us to support things like picking up hospital discharge over the weekend, just in terms of everybody recognising that when somebody is ready to leave hospital, the best thing that we can do is allow them to go home where it's safe for them to do so. And what we really want to do is continue to work in that development way with the independent sector providers in the city, and to secure that through a specific contract that looks at how we are supporting discharge in a timely way, not just doing it in a timely way, but supporting the flow as well. And the best way to do that, we think, is with a dedicated contract around that. So we'll develop that over the next couple of months, in line as well with the context of our new care and wellbeing contract for home care in the city. And yeah, I can answer any questions about it.
I just wanted to just mention mental health because a lot of what we talk about in the discharge space is around the acute trust around Sheffield teaching hospitals. But I wanted to make people aware we're doing some very specific work around mental health discharges, which are obviously a lot smaller, but often people wait a very long time to get out of hospital in terms of mental health. So a few things that we're doing, we've now put together a specialist team who are focusing absolutely on mental health discharges. So that's just coming into the fore. It's taken us a little while to recruit those social workers, but they're now there and running. There is a weekly meeting where we go through all the mental health discharges, which I've been joining on a weekly basis and working with my colleague Greg Hackney in the Care Trust, and that's been really helpful just in terms of working together and making sure that sometimes there were things that we would have done and access to things that we knew about that the Care Trust didn't, and that's been really positive. And the other thing we're looking at, if it isn't possible for people to return home, we are commissioning some step-down beds, and we have a new commissioning manager in that space who's actively looking at that. So I think it's a really positive picture that we've got in terms of mental health, which I think has often been neglected.
Can I just be... Sorry, I was just going to pick up on another point as well, actually. Just a note for celebration is the increase in referrals that we've seen as well into our carers support services. So we're really focusing on, when we're talking about making discharge personal, it's about improving the experience for the whole, the person and their family. And so there is a report within that graph as well that really highlights how since January 2022 and through until November 23, we've seen a significant increase in the number of people that we are supporting from a carer's point of view as well.
Excellent. I just wanted to comment, and then I'll take questions about what Janet mentioned. And although they're smaller numbers, sometimes they have a huge impact on, financially, particularly on the NHS when there aren't places available in the city. And also, just mentioned that myself, Councillor Thornton and Councillor Milson visited the base that is, the social worker, and it was very interesting, and they, gave us a lot of time, didn't they? Yeah, it was very, very interesting. Are there any questions? Councillor Rooney.
Thank you, Chair. My question is about the workforce of those that provide the services once these people are being discharged. So it's about I just think that at times we expect more and more from the workforce of the contractors in terms of the skill set that they are supposed to have. And I suppose I'm asking, are we sometimes not asking too much of the individuals concerned? And are we making sure that their remuneration is heading towards the agreement I believe we have in terms of, I think, is it Unison? I think we have an understanding with Unison that we will go towards a particular target. But my biggest, well, the other question was many years ago when I was in a similar position to yourself. Apart from the obvious fact that there are jobs in supermarkets that paid or do pay better wages than the care sector does, there was talk of trying to create a pathway, a progression pathway, a career pathway for those that are in care at the moment, so that, because at this moment in time, there doesn't appear to be one. Do you know what I mean? From starting in the care sector and progressing up the ladder towards possibly employment in the NHS itself. And I don't know whether that ever went anywhere. I do remember that conversation taking place. Sorry, I went on a bit there.
Yeah, if I could just respond to that. I think, first of all, just to say that I actually started out in a service that's very similar to our short-term intervention team. So really passionate that actually people are given the opportunity to develop social care and their work that they're undertaking as a career. So the work that I've done today with the team in Sheffield, so again, just focusing particularly on the short-term intervention team, but actually linking with the wider sector, is very much about acknowledging the skills that they, fully utilise, working in their role on a day-to-day basis. People are very passionate about the jobs that they undertake, and you know, often they've got, you know, all of them have got the right values that we want to see when people are working with individuals in our communities. People are very proud of the work that they're undertaking, but actually they're also really keen to develop. So that's one of the things that we're currently looking at. We're doing a piece of work with our local university and across wider the Yorkshire and Humber, and that's about developing that skill set, but also becoming a recognised qualification around the kind of work that they're undertaking. So that it is something that you can use as a formal qualification, which would be at a degree level, to be able to continue to develop. Just linking back as well, though, to what you've said around our work with our union colleagues, I think it's really important that we work in a proactive way with them. So at the moment, particularly around the short-term intervention team and the work we're doing, I actually meet with them on a weekly basis. And it's a really positive relationship, and really keen that they hold us to account on the promises that we've made for our workforce and vice versa. So I know that probably just answers part of your question, and we also need to consider the wider home care market, but I do think that what we do in our short-term intervention team sets the standard for what we expect across the sector.
Thank you, Callie. And I suppose actually we can discuss that further on item 15, which is about the development of the workforce strategy. So we can pick some of those issues there, I suppose. Councillor Milsom, did you want to ask a question?
Thank you, Chair. Yes, it did. You referred to increased referrals into carers support through the carers centre. So that's really great. I think that's really good to hear. But immediately makes me think: is there sufficient capacity in that service to deal with increasing referrals, and at what kind of rate is it increasing?
Yeah, sure.
And have we got something built in to keep that service at
We're currently in
capacity?
negotiations with the Carer Centre. I'm the strategic lead for unpaid carers, and Mary, who's here as well today, and her colleague Lee Teasdale Smith and I work together on that. I meet regularly with the chief exec from the Carers Centre, and actually it was the basis of our last discussion, because that was exactly what she was saying. You know, with in terms of the numbers they've got coming in, there's an issue. So what I've asked her to do is pull together some information for us, and then we'll be looking at what we need to provide, because it's a very positive service, and we've worked hard within adult care to make sure that people we actually sit, that Kelly was talking about, are the highest referrers into that service, which makes some sense because they're dealing with people at the beginning of their care journey. But know that those are discussions that we're having with the Carers Centre, and we're very, very committed. And actually in March, where you'll get a report specifically around unpaid carers. So yeah, we've got a very close eye on that.
Just a really quick little comment just back about that, just something anecdotal. So this week I was at the TARA meeting in my ward, and one of our community development officers brought along pamphlets from the S4C, the Sheffield Church's Council on Community Care. I think that's right, isn't it? And nobody in the room had heard of that. And I just thought that was, it just made me quite interested in, we're getting increased referrals to the Carers Centre, brilliant. I think there's maybe still some more work to do around key people in communities knowing about the services, you know, simple things like up-to-date notices on notice boards, community notice boards, things like that. Maybe we could look at how to increase that.
Yeah, absolutely. I mean, interestingly, we had an update to staff yesterday about unpaid carers, and one of the things that we shared afterwards was a link to the Carers Centre and what they do. SM4Cs are interesting because a lot of the work SM4Cs do, they've got a contract with ourselves, they've got a contract with the ICB, they do a lot of work from the hospital, but yeah, it's about making sure that people know what's there and what's available. But SM4Cs are great, they're incredibly useful to us. But there's also Sheffield teaching hospitals are putting some are doing some work with the Carers Centre as well, so they're trying to do more around the hospital setting so people get information when they're in hospital. I'll say our biggest issue with unpaid carers is identifying them, and part of it is even when we identify people, and I put myself in this situation when I was a carer for my mother. If someone had said to me, you're a carer, I'd have said, no, it's just my mum, it's not. So I think it takes on average 2 years for people to recognise themselves as an unpaid carer. So a lot of the focus we're putting on this year in our work with our staff on unpaid carers is about making sure people recognise an unpaid carer, and in particular we're going to have a focus this year on young carers, because we think that's something that people maybe often miss. But that's, I mean, obviously all the work around unpaid carers is multi-agency, and we have a group that meets, we have a strategic group that meets, so lots of work and effort going into that.
Thank you for that. Can I comment on that, because I was going to ask a question on page 45, 195. It was exactly about that. It's about carers recognising that they are carers. And there is something about, you know, the Sheffield Teaching Hospital is going to revise Do You Look After Someone guide. But how are we ensuring that that message is clear to our different communities? Because in some communities, looking after your family, it's just what you do. And people will not see it as caring because it's alien to some communities. So if I think about my upbringing, being, you know, from a different country, you know, it's very different. The language is very different and the approach is very different. So it's really important that we kind of also take into account that Sheffield is very diverse and different communities will need that message in different ways, and that accepting help as a carer is not letting people down that you're looking after, is actually making yourself more resilient, and I think that's really important. And can I also have another little comment about just the NHS bit of this one, the discharge programme? I think it would be good to have some notes sometime for some of the, you know, for the layperson, the no criteria to reside. I mean, I knew what it was, and I was like, okay, so if someone is reading this, is it no criteria to reside at home or hospital? And obviously, that is an NHS term for them to say that someone shouldn't be in hospital, but they're waiting to be discharged because they're waiting. So I think it would be good so that people don't find our report too kind of difficult to understand, because it's complicated enough, the system, without having the there'll be other things, but that slipped through our briefings. I'd not kind of seen it until I was revising for today last night. But thank you very much. Are there any further questions? Councillor Thornton.
Thank you, Chair. I just wanted to ask on somewhere else to assess beds, and I think that thank you for the work that you've put into this, because it's obviously very welcome and the report's very welcome. And when we had briefings on this, I know that we've said that we wanted to have a priority to clearing that backlog as well. So it's nice, it's lovely to see that that is halved. And when do you expect that to reach, hopefully, a zero level in terms of timescale?
I think that's really, are you talking specifically about somewhere else to assess? I would have to say, I'd have to check that for you. But the other issue, of course, is, I mean, at the moment, we're in the middle of a very busy time at the hospital. So the list is always being added to. But I think what we're doing in terms of somewhere else to assess is we're looking at system issues. So there's things that we're putting in place that will mean people will get moved through those beds more quickly. And I think that'll be our focus. I think if I said we'd ever get to zero, I'd be fibbing, because we're always going to have new people on. It's understanding that they're not the same people all the time, but trying not to have people in those beds too long. Now, the majority, I mean, the thing that interests me about the somewhere else to assess beds is they are for people who can't go home at that point in time. And we want to generally give them another chance to get back home and put things in place to do that. The majority of people will end up staying in long-term care, but what I want to do is make sure we focus on those numbers that we can get home, because if it's someone's last 2 weeks at home, 2 months, 2 years, it's more important that they're at home than in a residential setting where they don't wish to be. So I think a lot of our focus at the moment is trying to see what we can do to make sure that those people who don't need to remain in those beds can return to their home.
Councillor Sappwell.
So apologies if this, thank you Chair, and apologies if this information is in the report. It's been a bit of a whirlwind the last couple of weeks for me. Could I please ask what the average wait time was / is for a social care package once a patient's been declared medically fit in hospital before and after these interventions? Because my subjective impression is that things have greatly improved, and if the facts reflect this, I think that's cause for real congratulations.
So I'll pick up the internal provision, and previously we were looking at quite extensive waits, and some of that was around some of our internal systems and processes between acute and ourselves. So we did have some data that suggested anywhere between 10 to 14 days. However, we can say that we've reduced that, so at the moment it's on average between 5 and 7 days. What I would suggest, though, is that we are working really proactively with our partners to start to talk about early discharge planning, and some of the changes that we are working with our joint programme manager around will hugely influence that and create a much better experience for people.
As a follow-up to that specific point, are you accepting referrals before a patient is declared medically fit to begin that process?
We will accept them, but we're not getting them as yet. So that's why we're working with our partners to go through that process. Just with regards to the independent sector, I'm going to hand you over to Catherine.
Yeah, all those similar processes, obviously, and answers. So the brokerage team who work closely to get packages with the independent sector live working have changed their ways of working, and we've now got approximately half of the packages that are coming out from hospital in place, the person's home, within 48 hours of them becoming medically fit for discharge or no clinical need to remain. And I haven't got right now the figure of what it was before we made those changes, but we're working on getting those, so I'll come back to you. But it is an improvement because there's a focus on it. And in terms of, early discharge planning, really, knowing who's coming through, as with every, it's called Pathway 1, but that you could break it down into about 20 different pathways, actually. And a lot of the people that are in hospital are known to us before and are known to independent sector providers before, and we've referred to those as resumptions. And actually there's a lot of knowledge around there and working together to make sure that the provider's sort of getting ready to be able to take that person back home. But it's, we will continue to work to continue to improve on it, really.
Thank you. Alexis wants to come in.
For me, it's helpful just to follow up to your question, is our local ambition is that we enable people to be discharged within 24 hours of being no criteria to reside, and that all the improvement work that we are doing is so that we can work collectively together with partners across the city to reach that ambition. Because ultimately, from a point of view of the person, and what we have done in Sheffield, which is actually unique across England, is actually taking the framework of making discharge personal, so that from the point of view of individuals, that individuals should be seen to have positive experience and outcomes of discharge, as with unpaid carers, because it can be one of the most stressful and difficult times for people. So we want to make sure that people have, as such a great experience, but equally as a timely experience. And so all the work that you're hearing today is about getting to reach into that goal, and a lot of the work that's going on behind partners is to get to exactly that point of early discharge planning, which is the best practice model that we want to aspire to. So anything that could be support to assist that would be fantastic.
Thank you. I will bring that to a close. We have 3 recommendations. They're on page 40 of your pack, and they are as follow. So the committee notes the current performance in relation to discharge and progress in delivering phase 1 of the hospital discharge and urgent care delivery plan. Number 2 is approves the commissioning strategy to externally commission a specific discharge home care contract for a period of 2 years with option to extend for a further 1 year, and requests that the strategic director of adult health and well-being provides the committee with update on progress against the delivery plan in 6 months' time. Members happy with that? Brilliant, and thank you very much. And we go on to item 10, which is personalisation and direct payments update. Thank you. And we have Andy and Mary presenting this report.
Thank you. I'm Mary Gardner, Strategic Commissioning Lead for Direct Payments. Delighted to hear today to talk to you about the update on the report from the Personalisation and Direct Payment Strategy that we came a year ago to launch. We've got the update on the delivery for you. We want to give you some key highlights of what we've achieved over this year, particularly talk to you about what we're going to be focusing on next year. And Andy's going to talk through some discussion around a decision that we need around the way forward with the Direct Payment Support Service. Okay. So it's been a really busy year for us, and we've been very, very busy in terms of achieving what we set out to do in the first year of the delivery plan. Just to give you some ideas in terms of where we are with direct payments at the moment, we've currently got 2,330 people benefiting from direct payments. That's 394 children and young people, so under 18s, and 1,936 adults that use direct payments. That's about that's about a quarter of the people who use adult social care are using direct payments. In terms of budget, that relates to a spend of 48.8 million across social care. 45.3 of that is allocated for adults, and 3.5 is children's spend. That's a very similar amount to last year. However, we were able to give people an annual increase of 9.5% last April, so actually the overall cost has come down in terms of what people are spending their budget on. So in terms of our goals of the strategy, it's just important to just highlight those again. They're centred around increasing the uptake of direct payments and making it accessible and something that people want to be able to do, to be in control of their own care and support. We want to foster innovation, creativity, particularly look at the strengths of people and how we bring that into their support and how they're supported then to have the outcomes that they want to achieve. And we wanted to build on our previous improvements as well, which was really key. The improvement programme had been running for a year before the strategy was in place. Okay. So this year we've had some really significant advances in delivering our plan. I guess the first thing that we wanted to highlight was that we had a strategy launch event that happened in the spring. It was a really positive experience. We had over 120 visitors that day, all people from the public and people that use direct payments. It was a co-produced event, and it mainly focused on having lots of discussion tables about what people wanted from direct payments, what they wanted to see us do. And we also had a provider network as well, where many providers came that offered different types of support, came and showed and talked about what they did in terms of being able to support people. We also this year have created a PA register. We've done that in collaboration with Disability Sheffield. Feel really positive about that because that's something that we talked about here when we talked about setting up the strategy last year. So that's really good to have that in place. We've already know that we've had 11,000 footfall through our digital site. Some of that's been bot, but most of it human, I'm told. The register really gives us a really good platform because it gives us a place where individuals can advertise for person assistants, but actually person assistants or people keen to be a person assistant can advertise what they can offer too. So it makes it, for any future work that we do, it gives us a really strong platform of a place to be able to send people to use. And it's locally created in Sheffield, and again, co-produced with what people told us that they wanted to see in there. So that's really positive. We've been doing a lot of development work on our individual service fund pilot. So individual service funds are slightly different from direct payments, but also, I guess they're like a council arranged service, but with knobs on. So it provides people the flexibility and choice about how they want the support arranged. It gives them an opportunity to be flexible on a day-to-day basis. And what we do is, as a council, we provide that money to an individual service fund provider who then holds that budget for that person and spends it as they need to. And some of those providers might also provide direct support to that individual, but they'll also broker the other support. So we've been putting lots of things in place for us to be able to move forward with the pilot during the next year. which is really great. And I guess just before Christmas, we had a personal assistant workforce summit. That was a regional event that was supported by ADAS. And we worked a lot with our neighbouring authorities across Humber and Yorkshire, and with partner organisations that particularly have an interest around supporting people to employ their own PAs and PAs. The idea of the event was to think about how we can promote the role of personal assistant. Personally, I think it's the best kept secret that any job role that there is. But actually, we really need lots of people to know about it, so it publicises it. So the focus of the summit was to do something about personal assistants and see how we can work together going forward to promote the role. There's actually a visualisation of the event that we created during the day of all the speakers and the discussion that happened, and that's in your pack as well at the end of the report. So that's some of the highlights of what we've been doing. I guess over the next 12 months, we want to build on that, and we're going to take things even further. So again, building on the outcomes of what happened from the summit, in terms of about how we're going to promote and market and celebrate the personal assistant workforce. We need to think a lot about our publicity and how we work with that. So there's an intense work stream around how we're going to support that workforce agenda with lots of exciting pieces of work going on. And again, we're going to be working collaboratively with people and personal assistants to see how that goes. We want to focus on improving some of our training and learning offer, particularly around our social care staff. So we've done a lot of work in terms of talking to people about direct payments, talking to our staff, getting them familiar and confident with what direct payments are and who they're available to. But actually now we want to start building that confidence even further. So particularly thinking about how we plan creatively with people to think about other types of support or other types of activities that they might want to do that takes them away from something more traditional and takes them into usual everyday life. And then supporting that, we'll have work around positive risk-taking and how that fits. And we also want to use our expertise of our direct payments review team in mentoring and buddying and offering peer reflection to other staff across the council, across the whole of social care, just to build that confidence. So it's great that we've got lots of our policies and processes embedded now, and we've made it more simple. What we need to do now is build on that culture change and fixing that confidence in workers to feel okay about offering direct payments and individual service funds. We're going to roll out our improved direct payments monitoring process. So that's the process by which we ask people to show us how they've spent their budget over the year. We always got a lot of feedback saying that feels quite scary. It used to be called an audit, and people said that was really scary. So it's now the monitoring process. We went out and asked people what they prefer it to be called. We're trying to reduce the amount of bureaucracy in that, and we're also doing some work behind the scenes to try and model a risk assessment around that. So rather than auditing every single person to the nth degree, we actually look at where to focus our efforts, where maybe people have got a larger and complex support arrangements that they need a bit more extra support. And we're also introducing a check-in with people after 3 months to make sure everything's okay and that they're working, they know how the direct payments working and that they're comfortable with that. So that's a really positive step forward for us. And we'll also be launching our personalisation board this year. So that's thinking about our broader offer around personalised support. So direct payments is very much around people wanting to direct their own support and be in control of that. We also have individual service funds, which helps people that maybe have difficulties in being able to make some of those choices and making the day-to-day management decisions. But we also want to look about what that means. How do we personalise all our services, whether they're in-house or whether they're working with our provider framework and our contracted colleagues. So we want to make sure that that board is something that drives and steers the work going forward and has lots of governance arrangements in that. And that absolutely help us address that. And again, that will be a co-produced board, so there'll be people with lived experience that work alongside council colleagues as part of that board. We'll be piloting the individual service funds, so that's really positive as well. And we're going to be working much closer with our providers. So as you'll know, there's some changes in our home care contracts and how they're arranged. What we want to do is look at working with all our other providers, our smaller providers, providers maybe that are no longer contracted. How do we not lose them, but how do we foster what they do already and the knowledge that they have of the people in the city to help them think about how their support could be changed differently, make it more personal, make it more attractive to people that would want to direct their own support. So just making sure that we've got a whole range of offers around for people. We know people like to employ their own personal assistants, but we also know that people like the structure of having providers available as well to purchase support. So we want to make sure that we're really doing that. We've also been asked the people to, while we're working with providers, is to think about what quality marks that look like. So we know what we're governed by, CQC and our SCOF marks and all the other things that we have. But actually, what people tell us is we want to know how good they are, how well they turn up, how nice are the staff, do they meet my cultural needs, do they work in different communities? And that's the thing that we need to focus on in how we review the quality, so it makes sense to people when they're looking for the support that they want to buy. Okay.
I think Andy is going to. Are you? Do you want to ask the question now, or shall we wait until Andy? Is that okay?
Yeah. Hi everyone. I'm Andy Buxton, the Commissioning Officer for Direct Payments and Individual Service Funds. So in 2021, we received approval for the contracting of a direct payment support service for 2 years. And this was to be an interim arrangement with a request made by members that a full options appraisal would be carried out to inform and determine the longer term solution for the provision of those services. So an options appraisal has now been undertaken and we make a recommendation for the future model in our report today. We've engaged with a range of people, including those who have used the service and social care teams, and we've considered all the options and checked their viability. And through the engagement and feedback, along with the options analysis, this has brought out the benefits of direct payment support being provided as an in-house service as the preferred option. So the benefits to people who use direct payment for this preferred option is that it resolves confusion of what the service is and who provides it. It will remove potential advantages for one provider over others in the open market. It will ensure that we've got consistent information and support that's aligned to our personalisation strategy and the improvement programme. This option as well is viable within the existing financial envelope, and it maximises council resources, and will continue to offer a more efficient and effective support for people with direct payments. The strategy has been co-produced with people with lived experience, and we've continued to work with people to progress our plans over the past 12 months. So as we take our next steps this year with the delivery plan, we'll continue to work collaboratively with people and our partners and stakeholders to shape, design and produce new and improved ways of working, and that'll improve the development of the new direct payment support service. We're happy to take any questions, feedback or insights you might have. Thank you. Councillor
Ellis.
Yeah, question's been partly answered, and it's a welcome to. I welcome the fact that the strategy has been co-produced. But I just wondered, in terms of people that actually take direct payments, I'm referring to paragraph 3.2 on page 79 here, the stakeholder group. I just wondered whether you could give us a flavour of the involvement of direct payment users in that consultation process, and how that has shaped or amended the strategy.
Yeah, so we have a range of options open for how people want to work with us. So we work in partnership with Disability Sheffield, local user-led organisation, and we have an arrangement with them that we identify people that are interested in direct payments, or that they're employers of personal assistants, or they're personal assistants or parent carers. What we do is we ask people what they want to be involved in. So people have got the option that they can either be part of any of the work streams and any of the project groups that are actually created in designing some of the things that we've put together. We also have asked people if they would like to be members of the steering group, which was the group that led all the activity and managed that. We had 2 people with lived experience on the steering group, and they're looking forward to working forward on the personalisation board as well. We asked people have said that they like a range of options to be supported. So some people like to actually come along to the workshops. Some of those have been in person, some of them have been during Zoom and Teams. We also have an option where people can write in, and we've got an email address that people can write in and tell us what they think, and then give us their opinions. For some, we've met individually with them if they've felt that being in a group setting isn't appropriate. And we've used other options like Sheffield, Disability Sheffield Voices, which is a group of people with learning disabilities that also feed into the work that we're doing and what we've been talking about. So people really have a range of options open to them to make sure that we really hear the voices of people, because that's the most important thing, really, that people tell us what they want. We can guess what people might like, but actually listening to them and actually being in that conversation with them in terms of making our choices and how we design things is most important. So, yeah, I guess there's a various way. What we do when we have our events, so I talked about the strategy event and the PA Workforce Summit. We also had breakout areas and places where people could comment on different activities and plans that we had in place, but they were also able to give sound bites on videos, so they could just go away, tell us what they thought, and then we could watch that afterwards. That worked really well. That was a different way of us trying to think about how we engage with people. So yes, so we try to go into the public and sort of link in wherever we can.
Councillor Thornton. Thank you, Chair, and thank you for this. I think it's a really thorough report, so thank you for bringing this to us. I have a couple of questions that are quite different from one another. One is on the staffing side of things and one is on the user side of things. Do you want them both at once, or shall I? Whatever works for you, I suppose. So the staff with the proposal for option 5, with the staff on the current contract, and you've touched a bit on some of this already, being transferred over, how do they feel about it, and how are we easing any anxieties that they may have? And will they have access to the same or better, hopefully, contractual benefits than they're on at the minute? And the other was, as I say, on it was a piece of casework that I had later last year, with a person quite a bit of debt as they were struggling to meet their direct payments. They weren't claiming all of the benefits that they were entitled to because they had been under the impression that meant that a higher proportion of their budget would be taken into consideration on this. There was lots of anxiety. So I'm really pleased to see that anxiety is reflected as a central disadvantage within the report, because he was quite anxious about putting his hand up effectively and saying, I need help. And I'm pleased to see that sort of peer-led support with that, because that's really important. But in terms of people like that, how do we identify these people who may not already access user-led groups, who may try and may fly under the radar because of that anxiety that they have in accessing council support?
Mary, before you answer, could I take Councillor Hurst's question as well, and then, because we're running a bit over the time, so yeah. Do ask the question and then Mary can answer all of them together.
Mine's very simple, Chair. It's just a thank you very much for this report. I was a Cabinet Advisor in this portfolio when we started talking about this many, many years ago. I can see Alexis nodding her head. And the progress that it's made and the apparent benefits for the service users does seem to be working out as we intended it. So it's a thank you for the progress and a thank you for the work that you've done. Thank you.
Well, that's lovely to hear, so thank you very much for that. Shall I answer your second question around the support, and then maybe you want to talk about the two? So, yeah, I guess the thing that makes slightly difference for direct payments is that when they have their budget, there is a financial assessment and a contribution made against that, but that's actually deducted off the direct payment before it's paid to the person. And that's something that we do that's an administrative saving for us in terms of not paying out to then invoice people back. So, but we recognise that that's then difficult for people because they have to pay that money into the direct payment account to make sure the money's right. So the previous auditing process that we had was an annual process, and often we were chasing back a year and trying to deal with issues when things had gone wrong much earlier. So with the new monitoring process, we've got that check-in right at the very start, to start thinking about with people. We've got guidance for staff to talk about how the financial contribution works. We've got really good links together with our funding team who actually calculate the contributions, and we work really closely with our other finance colleagues around recovering and invoicing. I guess what the checkup, the fact that we do the checkup much further up the line now, and that was a targeted effort that we wanted to do, means that we can pick up if things are going wrong much earlier. So where people maybe aren't getting the right amount of funding, or whether they are struggling to pay their contribution, we now pick that up much earlier in the process, and then we can work with them to make sure that they're linking either back to the social work team or to the finance team to make sure that they are getting maximum benefits. We've also improved our suite of information that's on the website around direct payments, and we have some fact sheets on there, particularly around paying contributions and supporting people to manage their direct payment if money is becoming an issue, and how they can address that and how we can resolve that. So we're really trying to sort of try and make sure that people really understand what the ask is in the first place, but then that we can pick up if things are going wrong. And we're essentially trying to build better relationships with people, and the fact that we've got our newsletters, the fact that we're much more open. We've held a number of Meet the Commissioner events with Disability Sheffield as well, which means we're just much more public, I guess, and people know that the audit team aren't a scary bunch of people, that they're actually quite nice and they're there to help people.
Yeah, so just to pick up on your first part of the question regarding the existing team for the Direct Payment Support Service. That is, because there is an existing service, a team already in place for that, there will be regulations that will apply for that. So that team obviously would transfer into the council. Because that is a formal process, that hasn't started yet, because obviously we're awaiting for the decision to be made on the approved option. But that being said, we have been very open and honest with the incumbent provider and the actual team members who we work very closely with anyway. So they're fully aware of all the options that are being considered, and they've actually worked with us to look at the advantages and disadvantages of the existing model, what that might mean for the other options that we've considered as part of the options appraisal. And throughout the contract, we've worked very closely with this team, so they come with us and work with us at the various events that Mary's talked about, and they've been heavily involved in our work, so they are quite close to us already. So that gives us a really firm basis, really, for a positive start to these discussions, should it be approved. And hopefully make a very supportive process for those staff concerned.
Thank you. I'm going to close that item here, and I want to say thank you so much to the team, because it's really been amazing to see the progress from last year in terms of, you know, all the conversations we had about the PA and especially working with Partners with Disability Sheffield in particular on that point. It's been really kind of excellent, and thank you to the team for making it happen, and let's continue that way. So we have 3 recommendations coming from with this report. They are on page 72 of your report pack. First recommendation is that the committee noted the continued progress of direct payment improvement programme and delivery against the action from the strategy delivery plan, including the creation of a personalisation board to drive and govern future work. Number 2, endorse the planned activity for the next 12 months. And number 3, approve commissioning strategy option 5, provide a direct payment support service as an in-house service offer. Are members happy with those recommendations? Brilliant. We are running a few minutes late. We are on item 11. I'm just saying this because people always expect me to finish really early. So the items today are quite meaty. So item 11, you owe me time anyway. On page 115, this is the Adult Health and Social Care Policy Committee Climate Statement. And before we start, can I just say I'm really pleased that this item is coming to a committee, because Councillor Hurst and myself were the ones that fought for this to come to the individual committees rather than just be passed by SNR. So all committees have now got this item on their agenda, so that the committees can own their own statements before they go, back to SNR. Thank you.
So I'm going to open up and then I'm going to hand over to my colleagues here. So first of all, I just want to say, a thank you to members and to my team who have really committed to how we take climate seriously, particularly the impact on individuals and carers, and the impact of climate change on particularly vulnerable people across the city, and how we could contribute towards the citywide and council ambitions to achieve net zero. And for me, it's something I'm quite passionate about personally, so I think it's been really important that we have taken this really seriously in adult social care. And of note within that, just before I hand over to my colleagues, is that we see this statement as the start of a journey. We don't see it as the end of a journey, which is why our recommendations reflect a commitment to bring it back every 6 months for an update, but also to see this as very much as a dynamic process with our social care providers and our colleagues across the city, so that we can continue to go and build our commitment towards climate change. And alongside that, just also to note that we've had some early conversations with the Centre for Care and Health, which is a local university, towards how we can look at an academic look around actually how do we think about the social care impact on climate change. So very much I think this is a really good way to very much look at the learning and further development of this agenda. And so on that point, I'm going to hand over to my colleagues.
Thanks. Very quick intro from me, as normal. I think the report obviously seeks endorsement for the climate statement. I think I'd particularly like to draw committee's attention to paragraphs 1.10 and 1.11, which just highlight really that the actions that we'll take to tackle climate change have a wider benefit to the health and well-being of the population, and also, on the other side of that coin, the negative impacts of climate change do disproportionately impact on more vulnerable groups, and a lot of those groups will be the people that we work with in adult social care. So it's critical for all sorts of ways that we do continue the work, as Alexis has pointed out. I think the statement sets out well, kind of a high level, the things that we're doing. We've already started a lot of them. I talk a lot about our new home care, care and wellbeing contract, but that's a perfect example of both in our commissioning and our procurement. We had a method statement where we were asking providers what they were doing above and beyond the design of our service to help us with our climate impact and mitigation agenda, and the target operating model, of course, in terms of working in local community areas is better for people, it's better outcomes, it's better in terms of the climate, but it's also better in terms of mitigating the existing impact that we've had where, if, for example, we have extreme weather, we've got a footprint of staff and care and support that can work with people. Yeah, I don't think I've got anything further to add, actually.
So Laura Ellendale, I work in the Sustainability and Climate Change team. And I've been working with everybody to bring these together. So it's just really for me to restate, this is a journey. This is more of a statement of intent and looking at what we can do to improve things. And really, when it comes to social equality and our care, there's a really strong link in relation to the impacts of climate. The kinds of decisions that this committee will be making aren't necessarily going to be explicitly reducing emissions. They're not, you might not be approving having solar panels put on buildings, but actually the decisions that you're making are really, really critical in terms of how we adapt and build resilience to be able to respond to the changing climate in the future. And as we've said, it is our disadvantaged groups who tend to be disproportionately impacted by climate change. They do tend to have a lower contribution towards carbon emissions, but are often the first to feel the pain when things happen. So really, really happy that this has been looked at in the light that it is, and looking forward to working with you in the future. Thanks.
Thank you, Chair. Thanks for presenting this. There's a couple of things that I'm slightly struggling with, really, with this, and it's not anything about particularly what's the content of the climate statement or the report around it. It's just to do with the practicalities, really. So I agree with what's said in this report about lack of commitment from government in terms of policy and funding. It's just a huge factor in what it's possible to achieve, but also sort of slightly mindful that perhaps we haven't always prioritised these kind of actions as much as we can. So I've got one question around, are there going to be working groups that are set up to actually enact some of this? Because as you say, it's not this committee that's going to be deciding about solar panels on buildings. That's got to happen somewhere else. You know, I worry a lot about some of the older leaky energy inefficient buildings that we've got throughout the health and care sector, and how far behind everything is in terms of insulating those buildings, and that affordable clean energy is out of reach at the moment, and that's not happening either. So you've got the climate implications of all of that, and then the fact that some of our external providers are struggling financially as a consequence of all sorts of other factors recently. They can't access large sums of money they need to retrofit buildings. So much as the ambitions set out here are obviously what we need, I can't see that any action's going to happen very soon. So it's going to put more expectation on these external providers to enact mitigations and infrastructure improvements, but I can't really see how they're going to meet those. So have we got something hidden up our sleeve, or are we really in that sort of dismal position? But practically, how we're going to help people to move forward with that. And just wanted to comment as well that I do feel quite conflicted about potential negatives of increasing use of tech-enabled care. It's clever, it's brilliant, it's reassuring for people, but I'm constantly thinking the more tech comes into people's lives, the less human contact potentially they have. And can we just, you know, when we're looking at, let's not go down a route of bunging a load of tech in to solve a climate problem at the expense of the human side of it. We need to work out a clever way of doing both.
Councillor Smith.
Thank you, Chair. Again, apologies if this is simply something I've missed in the papers, but I don't see any mention of the environmental impact of medical care and equipment and its associated waste. And I don't see it as a reason to reject the recommendations per se, but I would like the issue of medical care equipment, the disposal of such items which are often single use, to be specifically addressed in the workshops outlined in recommendation 2. And again, I don't reject the recommendations, but I'm not sure that point 1.11 is correct in asserting that adult health and social care is not a major contributor to climate change. I think actually the BMA, the NHS recognise just how much of an impact single-use medical equipment is making to climate change. I would also like to see our Waste and Street Scene Committee involved in these workshops, as medical refuse collections are a particular stressor for my constituents and again have a direct environmental impact as a result of adult health and social care. Could this be explored? Thank you.
I could respond to a couple of questions that I'm going to hand over to colleagues. So the first question, I think in terms of particularly the working groups, how set up and the practicalities of that. So one of the key things for me was about working with our social care providers around how we find solutions both in the immediate, short term and longer term. And one of the commitments we've made is to come back with the action plan that comes from these workshops, because I think that then means that we're co-producing what we're doing with not only with our social care providers and also our health partners, because I think that becomes meaningful and practical in how we respond to that. The immediate things that we can do just now, which is noted in the committee report, is working with our current contracted social care providers to look at the impact of climate change, and that's particularly in terms of business continuity. So for instance, at a very practical level, is when, for instance, there's a heat wave, for instance, it's making sure that individuals are safe, you know, that there's practical plans in place to respond to that, or when there's flooding, that there is clear business continuity, because ultimately social care doesn't go away. It's 24/7, 7 days a week. And so for us, it's making sure that we can continuously go and deliver care. So that's the immediate practical actions that with our social care providers. The second bit is around the kind of practical changes that people can make. So for instance, when many years ago when I used to manage care homes, for instance, one of the things that we used to do was actually sometimes grow our own food, for instance, you know, and actually there's a bit about actually there's sometimes very different ways of working and which could promote and actually enhance how you promote. So for me, one of the key things I think will come out of the workshop is not so much, it's just about the investment, but it's actually what can we do differently together that could actually mitigate change. And I know there is a range of really good providers. We have actually got 229 regulated providers across the city, and actually there's a lot of good ideas from our workforce. And so I think that actually having that collaboration, that event will I think help to draw that out together in a very practical kind of way. And that's where I think working jointly in partnership with Laura and our team will be helpful, because me it's about saying what else can we access through business grants, through other activities that we could bring into the social care sector and support, you know, ultimately our local providers. So that to me is a key kind of part of collaboration. The second bit in terms of waste is really interesting. So there was a report to committee in November 2023 that basically set out our approach to changing how we work in terms of equipment adaptations. And as part of that, our contracted provider is being tasked with looking at how do we increase the recycling rates of our equipment that we provide. So that was highlighted in November, and that's part of the work that's sitting behind us. In terms of the wider medical waste from NHS, that would obviously be the purview of Sheffield Teaching Hospital, Sheffield Health and Social Care Trust and Sheffield Children's Trust. And as part of our collaborative working, what the assurances I'll be looking to seek as part of this work is how that's being taken forward as organisations. And so I'll do that in partnership with the ICB and with the trusts as part of that kind of working. But for me, I think the crux of this is collaboration, you know, and there'll be sort of slightly different arrangements for medical waste as there will be for equipment. But I think through bringing that together in a really joined up way, there's ways in which we could, you know, support each other. So yeah. So for key for me is collaboration and all this to take it forward. So hopefully that's helpful.
Do you want to come back in quickly?
Just to come back on a very specific point, I would like to really focus on the impact on kind of individual, maybe unpaid carers who are filling their own bin with medical waste, and I think that needs to be considered as part of this.
So it's a very good point about the bin waste, because that's actually been picked up by actually our wider social care issues, because actually through members' inquiries that's actually came to us actually in different ways. And what I kind of seen that is in two ways. Number one is actually how is our wider social care providers recognising some of these issues, but also secondly, whether potentially indicates there's other issues and vulnerability. Because one of our challenges, we don't work with everybody in the city, but some days can be an indicator of vulnerability. So one of the key things for us is actually working with our colleagues across the council to say, for instance, you know, if there is other parts of the council involved with individuals and they're seeing that, let us know, because actually that could also be a sign in which we need to intervene and support people. So for me, it's about recognising how we very much recognise the wide range of impacts of climate change. So thank you.
Yes, thank you. So I think one of the important things to think about when we talk about net zero climate emergency is there's two different areas of activity. So there's the mitigation, which is the avoidance and the reduction of actual emissions, but then there's the adaptation. And that's really about an incremental transformation in terms of how we respond to the risks of climate change by building sort of resilience, flexibility into our decision-making, our services, and actually our ways of thinking in order to protect people. And that's one of the areas that for this committee is going to be particularly key, because as things continue to happen, you know, it takes a long time for the emissions that we reduce now to have an effect on the temperature of the climate. And there are changes that are going to happen to our climate that we cannot do anything about now. So we do need to be able to adapt to the changing climate in the future. Obviously, the more we reduce the emissions now, the less we need to adapt. But what's really, really critical to this is that what we see as an emergency right now, such as a flooding event, that's going to become more frequent, and actually that might not be necessarily seen as an emergency in the future. That might be common. So it's about building our services and redesigning how we're working in order to be able to respond to those challenges, but not necessarily looking at it in the sense that we do at the moment as it being one-off emergencies, and then thinking about the effect that that has on people's access to our services. So there's a number of different things. We have a lot of different plans across the various committees in terms of who will be making certain decisions. So we have the Transport, Regeneration and Climate Committee who oversee climate, but plans relating to council buildings, for example, they'll go to different committees, so they may not always come here, but what we want to do is look at how we can work together across all the committees to have that joined up approach. So it might not be you making that decision, but you're feeding into that process. Just in relation as well, in relation to sort of saying with the emissions from the care sector, I think it's just important to note that sometimes the words can be used in terms of looking at all of our emissions. So if we think about all of the emissions of Sheffield, proportionately speaking, the care sector is relatively low. The public service emissions are relatively low in comparison to some sectors where they contribute over a third of emissions. So it's not to say that they are not significant, because they are. So I just wanted to clarify that as well. And sorry, one final point in relation to climate adaptation, just to go back to that. We are actually currently working with services across the council on climate adaptation service plans. So what we're doing there is reviewing the climate risks that each service have in terms of their operation, what happens when emergencies, as they're currently considered, happen, in order to improve things and have the ability to be more flexible and resilient in the future. So we are also working on plans that you will see at some point in the coming months. Thank you.
Thank you. I have Councillor Phipps.
Thank you, Chair. And thanks for this report. It's good to have it at this committee, and it's interesting to see the interest in seeking a partnership with academia raised, which hopefully will be fruitful. In the Adult Health and Social Care Policy Committee statement, in the Statement of Climate Commitments, it says that it's difficult to quantify the emissions that our adult health and social care services contribute to the city's emissions. So that just made me wonder, what work has been done to map the footprint of SCC, at least SCC, Adult Health and Social Care Services? And linked to that, in 1.15, it talks about contract monitoring and ensuring contracts have plans to support our climate ambitions. And I was just wondering, in that, is there any request in contracts around climate footprint monitoring of the services that we are contracting? Thank you.
So I can certainly say in terms of what's being done to monitor emissions. So one of the reasons that it's really challenging is because it's not necessarily just what is within our council, and it's also to do with how our reporting and internal data systems that the electricity, the gas, the emissions are reported through. So we have committed on the back of the annual climate progress statement that went to transport regeneration, in December. We have committed to looking at what can be done to improve that moving forward, whether we need to have more granularity of the data. Unfortunately, it's something we're looking at doing. We have tried to get as much information as we can, but at the moment, in terms of the city, certainly the granularity that we have is the public sector. But we will continue to work on that to try to give a more accurate position.
I'll take the contract monitoring question. So, yes, it will, in short. When we go out to procurement, there are method statements around what providers would do individually, and their returns, their tender returns, form part of the contract documentation and part of the contract monitoring. I think the two things that are really critical are Alexis's point about collaboration and also, as you raised, the academia. So we'll know just from all the work out there that doing less of certain things is going to have a positive climate impact, but it's important to try and measure it. So we'll have to work collaboratively with partners and with academia to sort of get an idea of that footprint. But, you know, if you print less paper, you can make a sensible judgment that that would be better. So again, with our home care providers, all of our successful providers on our new contract have submitted their own climate impact and mitigation plans. We will monitor them, and then we will work collaboratively with them as a group where there's best practice to try and take another step.
Thank you, Councillor Hurst.
Thank you, Chair. I think probably this is too early in the process to ask this question, but I'll ask it anyway. You've talked a lot about how you're going to achieve impacts through collaborative working and recommissioning and contracts, but have you given thought to going forwards? For a lot of the service users, it will be about raising their awareness and their education of what they can do to improve the situation for themselves. Is that a strand in there, or is it too early?
Yes, sorry, my voice is going. Yes, it's absolutely a key strand within this, because for me, one of the key things of climate change is actually the impact on individuals. And I think, as actually Laura said, is that one of the things that's really struck me about listening to what's going on is actually how do we think about what this means, not only 2 years ahead, 5 years ahead, 10 years ahead, and actually this will become part of people's lives, is ultimately the impact of climate change. So for me, as part of the work that we're doing, particularly in co-production, and actually all the work that we're doing as we take things forward, is about listening to individuals and carers, and actually working with individuals and carers so we can think about not only raising awareness, but on a very practical level, how do we also prepare individuals and carers for the impacts, of climate change. And I think that's his way for me, is I think this is such a big agenda, but also quite complicated. It's quite complex, because I think, and the reason why I've taken the approach with the climate statement is this is the start of a journey rather than the end of a journey, and is actually in asking for 6 monthly updates, is because I see this as something that we'll need to continue to kind of prioritise and look like over the next 10 years, because ultimately I think as the science behind this becomes greater, as the learning becomes greater, we'll be able to not only inform the conversations with individuals and carers, with our providers, but also, with our wider partners. And that will then make sure that, for me, I think the key thing is that we've got an action plan, we're following it through, and we're continuing to go and develop it. So absolutely yes. And to come back to the point that was made earlier on, for me, one of the key things of reaching it with academia and to do a partnership with academia is to get the learning behind this, because one of the things that really struck me when I was looking at all the data and the science and my nutshells was actually, how do we get really good data behind us? How do we get, learning behind us? How do we get science behind us? And actually, what does this mean for people, for carers? What does this mean for our providers? And how can we, have a real kind of academic programme around it? And I think that'd be something that'd be quite interesting to continue to go and develop and take forward. So yeah, I think it's a really good question, and it's absolutely core to, I'm going to say as the director, as the health and social care, it's absolutely core to me, I think, is about what does this mean for people at the end of the day.
Thank you. I'm going to take Councillor Rooney's as the last question.
Thank you, Chair. It's an apology for the interruption, a moment of brain fog. I don't know what I was doing there. The reason to provoke that was the disposal of clinical waste. There used to be a specific service, the yellow bag service, where people would put it out and it was collected. I just thought, oh, well, what's happened to that? But then since then I've had another thought. The clean air zone and providers who operate within the clean air zone and their employees travelling from one appointment to another, do they qualify under the compensation scheme for cars? Because they will have to travel within that zone, won't they, on a daily basis? I'm just wondering if there's any compensation scheme for them.
I can answer that one. So when we've been doing our recommissioning contract and we're aware that there will also be impacts. So for ourselves is we would build it into our process with providers who are working with us on commission, because ultimately we would need to make sure that that providers' costs were covered ultimately in relation to that. I think that my understanding, though, is when we did our initial, and I think this is where the climate impact assessments, when we've been doing the procurement, has been quite helpful. I don't know if that's I could answer for my aspect. The other aspects around climate air, so I know there's wider work around that. I don't know if that's helpful.
I think I can answer that question. Cars don't come under the cars anyway. It's only taxis, buses and vans. So cars are not, so unless a business uses some kind of transport, there is a minibus or a van, like any other business, they would have to, if they enter the clean air zone, they would have to pay. But if they're using cars are not affected. I think this is really important because people really get confused about this, and we don't want to put messages out there that cars are being affected by the clean air zone. So because most carers that travel to people's homes, I think it's important to map, for example, the impact of our workers that use cars. And I think that's why you made the point about the local, working locally is really important because it also reduces the impact of the use of, certain kind of transport. I think it's really important that we don't kind of muddle the water because cars are not affected. So it depends on whether a business, gives a van to to carers, which I would imagine is not practical because parking cars is hard enough. Parking outside people's homes. So I think that I think if there are a few affected, it'd be like a really small number. I can't think of carers travelling in a van to go to visit homes unless they're carrying some particular equipment.
If I can just follow on, absolutely, cars aren't affected, thank you. I guess you could consider that within the whole sort of adult health and social care service, there are vans used, there are larger vehicles used. I'll take that question away and speak to the guys who run the clean air zone and just get some clarification on that. But certainly something that needs considering. Thanks.
Thank you, Chair. Just quickly on that, I suppose I'd appreciate also if we could be kept in the loop on that, just as a lot of people will use minibuses to travel to different services from the services that they currently provide. I know a lot of people from the social clubs that I work on in the evenings, they will travel as part of a minibus, particularly for people who are in wheelchairs, so we don't want to be disproportionately affecting that group of people, as they will be needing a minibus to travel to different services. So I'd appreciate an update on that. Just to get
absolutely, and certainly in the way we travel route map, we're really trying to make it clear that this is about having accessible transport as well. So it's not saying that nobody will be using cars, it's that everybody will have a suitable and accessible option that they can take. Absolutely, we'll keep you in the loop. Thanks.
Thank you. So we have 5 recommendations. These are on page 116 of your pack. So they are as follows. The care policy, the Adult Health Social Care Policy Committee agreed. The Adult Health and Care Policy Committee climate statement attached in Appendix 1. Note that dedicated adult climate focus workshops will take place during 2024 with social care providers, voluntary sector and partners to agree a long-term social care action plan to realise our climate ambitions. The resultant action plan will be brought to a future committee for approval. Note the intention to seek a partnership with academia to consider the adult social care contribution to climate action. Note the intention of the strategic direction to embed within our contract monitoring process an assurance that all providers that effective business continuity arrangements to respond to impact of climate change and have plans to support our climate ambitions. And 5, request the Strategic Director of Adult Care and Wellbeing provides an update every 6 months to committee on delivery of the statement. Are people happy to support those recommendations? Thank you very much. Item 12 on the agenda. Thank you so much. Thank you. which is on page 165 of your pack. It's the adult social care complaints annual report and learning from feedback annual report.
Hello, Dawn Bassender, Chief Social Work Officer.
Thank you. Andrew Drummond, Safeguarding Quality Assurance Service Manager.
So we're just here to talk about the complaints report. So learning and feedback from individuals and carers is obviously an absolutely essential element of our continuous learning and improvement, an approach to our and core to delivering on our strategy of living the life that you want to live. So we just want to tell you a little bit more about that today.
Thank you. Yeah, we're pleased to bring this update to committee today. We want to embed a culture of learning in adult care and wellbeing, and complaints we see as part of embedding that, listening to people in Sheffield and making sure we take the learning from issues raised, including compliments, and making sure we're building on them, embedding that culture of learning across adult care and wellbeing. The report pulls out 4 key themes. I can go across them, which are assessing needs, provision of support, delivery of care, safe pathways and transitions. And we've looked at the figures in comparison to previous years over the last 5. Slight increase, where we've got 163 now, 152 last year, where we feel that's attributed to a new recording system, making sure that they're all logged on that one central system, which again is not necessarily seen as a negative, but something we can build on to make sure that learning is captured. And then a number of actions included in there, which we're looking for recommendation on from committee.
Thank you. Have I got any question? I just wanted to make a comment myself, if that is okay. I think it's really good to have this report to the committee. I think the complaints report for the whole council goes to the audit and standards, and the reason why this has been brought to us is because we want to have like transparency, and also we want to improve what we do, and so this is part of that conversation about being as transparent as possible, and I think the fact that we are capturing data better, so that might be one of the reasons why the numbers are slightly higher, apart from the fact that some of the years we're comparing to were the pandemic year and the year after, so that could also be, and also how easy it is for people to lodge complaints might be the difference. And I think what's important from my point of view is the fact is what we do with the data. So it's the learning lessons that is important, because that's something that we've been kind of asking for in terms of how we want the adult health and social care sector in the city to work. So I really welcome this report, and I know that we're going to have it every year now. So hopefully next year we can say what we've learned, and there will always be errors and mistakes. So in the 2 cases there, for example, there were some calculation errors. But if you think about how many people we serve, we have two where we had to compensate financially and not a huge amount of money. I mean, still we would like not to have to do that, because obviously for those 2 individuals it's really stressful. And we don't want to, yes, so thank you very much for putting the report together, and being a first is always a bit of a pilot in terms of comparison, so hopefully we can see the lesson learned and improve that way, improve services further. Are there any questions on this? Councillor Nelson.
Andrew, you referred to very briefly to compliments as well, and I wanted to ask about this. So it's Angela's just set some of this in context in terms of numbers, because actually if you keep your ear to the ground in the social care world and you know, if you're a councillor and you pay attention to your inbox and your voicemails, you could get under the impression that it's dreadful and everything's a mess and everything's complaints. And of course it is a very small proportion. So the context is really important, isn't it, in terms of numbers? But also to set it against the context of compliments. Is there an equivalent kind of feedback loop for compliments as well? And are they analysed in the same way?
Thank you, Councillor Milson. They're logged on the same system, but I don't feel necessarily, even when I was looking on the website, perhaps need to do more to advertise to the public about how they can log a compliment. Internally, we've got a way of staff being able to pass on gratitude to each other, but I think we need to do more how we can get that message out to the public as well.
Yeah, I think it's a general thing, isn't it? We're much better at complaining than saying thank you and I really appreciate you. But people do come back and say that. It's just we don't record it. Again, is capturing the data and then what we do with it. Are there any other comments or Councillor Hurd?
Sorry, I've not been to this committee for a while, so it's really nice to see the progress. And thank you so much. Again, it's a comment. Thank you for bringing this here. I think it reflects how importantly we take learning and the experiences of the service users and take learning from that experience to make it better for them. So thank you.
Okay, so, Councillor Thornton.
Sorry, Chair, thank you. I wanted to echo what Councillor Milson and Councillor Ardender have said in terms of it's really welcome that this is a report that's coming here and we're keeping it out in the open. I think that takes a lot of bravery and it shows a cultural change. So I'm pleased to see that. And seconding the recording of more positive things too, because we do need to put this out in a public way. You said we did. Both positively and negatively. Like if we've got something that people want to shout about, then we need to do more of it. And so I'd really like to see that going forward. I just have a quick clarity question that I noticed really late last night, and so apologies for kind of landing this on you. And do forgive me if this is a stupid question. Through Appendix 2, as it kind of goes through the thematics of the complaints and the outcomes of them, but the totals in the outcomes column don't total the number of complaints in the left-hand side of the thematics. So, for example, 211, which is on our page 187, there's 107 on the outcomes, but there's 124 total complaints, and I think it's similar throughout some of the other ones that go further. So I'm just wondering if you can clear that up for me as to whether I'm being a muppet or if we can get that clarified. Thank you.
I think what I'd have to do on that one is go back and look. So I can't necessarily give a full answer on that one right this moment, but we can go back and check and come back.
I thank you, and apologies for landing that on you at the last minute. I appreciate that, and it'd be good to get that cleared up. Thank you.
Yeah, Councillor Milson, I think it might be because some complaints are go into different columns, so it's the same complaint, but it goes in two. It says earlier on. That's why the number don't add up. But please do check and see whether that is the case. Oh, Alexis.
We could follow up on that one. I think what it is an Appendix 1 is the annual complaints report from 22 to 23, and that gives the data from then. But the Appendix 2 is our analysis against a quality statement set out by the CQC themes. So some of the data is different because what we've also taken into account is, I understood it, was also the later data that's came in through 23 to 24. So there will be a bit of a mismatch between the Appendix 1 and Appendix 2 for that reason. But again, we could follow that up. But the key thing for us was in Appendix 2 was actually thinking about the CQC quality statements, was actually how was our complaints against these themes. So what we can then do is take the learning very much into our improvements that we're doing within the service. But certainly we'll follow up and just to make sure. But that was certainly, I think, was the reason when I was the sort of slight differences in the numbers between Appendix 1 and Appendix 2.
And just finally, Councillor Milson.
Thanks, Chair. I just had another little tiny question. I just wondered how care opinion feeds into the data that is captured, because that's that is a more sort of holistic, people are asked to give their opinion and it could be positive, negative or anywhere in between. It's not a formal complaints service, is it? But it does capture people's opinion of the care they've received on a more sliding scale. Do we pay attention to that feedback?
Yes, we certainly pay attention to the feedback. Dawn might be able to add a bit more, but I don't believe that's necessarily logged within the case recording system when it comes to complaints. Would be my understanding.
Yes, that's correct. It's not logged in the system that we're reporting on today, but absolutely we take all feedback very, very seriously. And part of Andrew's post is collating different elements of feedback from different places so that we can really learn and grow and develop from that feedback. So absolutely all feedback is taken very, very seriously. But this is just the complaints element that we're reporting on today.
Thank you. So we have recommendations on page 166, and they are as follow. And so that the committee endorses the Sheffield Adult Social Care Complaints Annual Report 2022-23 attached in Appendix 1, notes the analysis complaint by Care Quality Commission quality statement attached at Appendix 2, endorses the Learning from Feedback Annual Report attached at Appendix 3, notes that engagement will be undertaken during 2024 with individuals and unpaid carers to continue to build our approach to learning from feedback and using this to inform service improvements and strategic developments. And finally, agrees that the Strategic Director of Adult Health and Wellbeing provides 6 monthly updates on our learning from feedback and subsequent service improvements as an assurance to committee that adult care and wellbeing are continually learning from feedback. We're all happy? Thank you. Thank you so much for the report. Really appreciated. And we are on item 13, which is our financial recovery plan update. Thank you, Jonathan.
Morning, everyone. Jonathan McKenna-Moore, the Service Manager for Business Planning and Governance. I'm here to present an update to 2 reports that were brought to committee in November. First one was the report for budget saving proposals for the 24-25 budget. And the second one was the linked recovery plan to address the overspend in 24-25. So there is a full table addressing the changes to the budget plan that's set out at section 3.7, and that details the changes that have happened since November. The main one there is following the autumn statement. There was an increase in the amount of in the national living wage that increased our fee pressures by 4.8 million. There have also been some changes to the amount of income coming in to adult social care. So the net result was an increase of 3.7 million. So back in November, we had a savings plan of 9.3 million, and that's now increased to 13. So the table at 4.8 explains the changes that have happened to the savings plan for the budget implementation plans that will go forward to Strategy and Resources Committee and then full council approval. So those are for noting at committee. Most of the changes relate to income. There's not a lot relating to actual different activity. So it's a revised amount for the contribution uplift, a revised amount for the amount of current contribution income that's being transferred to the permanent budget, and also some income relating to health. The only one that relates to activity is around some reviews, and that's not an actual change, not an actual increase in the amount that we're expecting those reviews to achieve. It's bringing that activity forward so that more of it is realised in year. Following that, one of the items to pick out from those changes is the realigning contribution budgets, 1.05 million. The effect of that has a knock-on effect on the recovery plan, which was the second report we brought. So we've had to revise the recovery plan and the carry-forward pressures. So that 1.05 million, because that income isn't now offsetting the overspend, that increases the amount that we need to achieve through the recovery plan. Not by that full amount. We've also reviewed some of the pressures. So there were some costs that we've got in year that are now in business planning for next year, so we don't need to count them twice. So we have to increase the recovery plan target by 800,000. And the appendix that we provided gives the full amounts in the recovery plan, but the changes from November are detailed at 6.6. Everything else is the same as it was in November. I don't know if there's any questions.
Thank you. We've had like really long conversations about this in various briefings, and it's really complicated, and it's basically the effect of the unexpected. It's not that we weren't expecting a raise in national living wage, it's just that the increase was much higher than we had envisaged, even with the prudent calculations that we normally do as a council, and the impact is, on us is quite considerable. To 5 million, that is obviously mitigated against some extra income. So we are only asked to note these. It's the same for all committees at this stage. Are there any questions or further questions to the ones that we've had in briefings? Are people happy to take the recommendations that are on page 202? So they are note the changes to the committee's budget plan since the November update, and the proposal being brought forward to close the 2024-2025 budget gap. Note that 2.8 million more social care grant ring fence for adult and children social care than assumed in the council's planning has been received, but 4.9 million less of ring fence services grants received. To know that this has resulted in a subsequent increase 2 million social care grant to Adult Health and Social Care Policy Committee, but decreased of 0.9 million corporate funding to Adult Health and Social Care Policy Committee. Note the impact of funding charges on the 2023-24 carry forward position and recovery plan for 24-25, and note the recovery plan to mitigate underlying demands and cost pressure 24-25.
I'm just doing some mental calculations, and I might be really off the mark. But the numbers that you've just read out in the recommendations, the net result of that looks like more pressure on children's social care. Am I reading that right? An increased pressure for children's, because we're picking up net more than children's will be through that balance of money gained and lost.
I'd have to check with finance colleagues about how that's been divided, because my understanding was it was an increase overall in the adult social care grant. So it's more about how that's been divided, that overall increase has been divided between. So it's not that the money has moved across from children's to adults. It was that an increase in grant has been split in that way.
Is it a concern?
I think it would have been picked up in other parts, because we discussed this in leaders' briefings, we discussed this in SNR briefings, so I can't recall like a shift from adults to children. I think it's just the calculations. Is basically money that we'd put towards the recovery has now had to shift to mitigate the extra pressure on the budget setting. So it's still from adults, it's not from children. I think sorry, Alexis, do you?
I think we could request a response from finance colleagues. I think what this relates to is there's two different sets of grants. So in now chronology wrong here, is in December time when after the autumn statement, essentially there was also within that there was an additional set of funding to social care, and that funding is what we've noted here in December time. And then in January there's been a further announcement, for social care grant, and that has been prioritised towards children. So I think there's two different sets of grants that have been spoken that have came out in the last in the last 2 months, which is, I think, the context of this. So what we could do is we could ask finance colleagues to go and just clarify the different grants that have came in and the allocations of these. If that makes sense.
Yeah, I don't think the extra money that has been allocated last week. I think it was Wednesday, wasn't it? I don't think it's mentioned in here, so it's got nothing to do with it. But I agree that the wording is really kind of super complicated, but that's lawyers for you, isn't it, Sarah? So are people happy to note these recommendations? And we will just double check what the implications for children are, if any. Thank you, Jonathan.
Thank you.
We are on item 14, which is our target operating model and partnership model update.
I'm going to introduce, and I'll also introduce my colleague. So I'm going to give an update about our target operating model. So today, and I think Ravina was meeting, I'm going to introduce Danielle.
Hi everybody, my name's Danielle Grant and I'm responsible for communications in adult care and wellbeing.
So I'm going to give an update about our target operating model. Before I do that, I want to start with a note of thanks to all the individuals and carers, our workforce and team, and members and partners who have supported the development of our target operating model. And I want to formally note that because there's been a huge amount of work over the last 2 years to go and take this forward. And Danielle, who's with me today, has actually been leading a lot of work around our communications, which I'm going to come on to at the end of the presentation. Is what this report does is summarises our progress in developing our target operating model and our strategy within social care. And a bit of a context to all is about 3 years ago when I came into post, is one of the first things I did was a listening exercise. It was listen to individuals and carers, to our workforce and to members, to our partners about what was the issues that we're experiencing in terms of social care in the city. And ultimately what that then did is led to a plan to go and co-produce a strategy, our very first strategy, living the life you want to live, with individuals. And then that led us to say, how do we realise that on a very operational basis? And the target operating model, effectively, for us, is a very, very fancy way of saying, how do we operationalise that strategy and how do we make it real from a point of view of people? And so what it describes is a way in which we simplify the way in which to access social care services. That was my first big thing. That's what people talked about us. But also, secondly, it was to improve our web offer. Our Sheffield directory, which you've heard about in previous committees, now reaches about 50,000 people in terms of hits every week, and which is excellent. And that's a huge step forward from what we had, 3 years ago. But equally, what we've tried to do over the last 3 years is very much moved to a model in which we have specialist support. So we have specialist support for people with learning disability in particular, specialist support for older adults and living with dementia, and specialist support for people experiencing mental health. And alongside that, we have a far greater focus towards personalisation, which you heard today. and also a greater focus towards earlier intervention and prevention, which is a core duty upon adult social care, and actually is set in the Care Act as a core duty for us. So for me, it's been one of my core kind of frameworks in going forward. And, you know, for us, what the target operating model has done is given a clear kind of framework for take forward all the developments. And over the last couple of years through committee, and this is where I want to thank members who've been along with us in this journey of significant change, it's really all the papers that have been to committee have ultimately helped us to kind of realise a lot of the things which is in the model today. And that is a huge mammoth step forward for us. And as we go in forward for the future, for me, collaboration and partnership working is key to this. So 4 big areas of work is very much is continuing to go and streamline our access to our services, so that from a point of view of the person, people have the right support at the right time as easy as possible. That is my fundamental belief. Secondly, that big programme of work is on mental health. As I actually chair a programme of work around that, and for me it's about ensuring that people experiencing mental health have experienced, you know, really responsive and excellent quality services across health and social care. Secondly, people building upon our all age autism strategy and our learning disability strategies is very much people with a learning disability are able to live the life that they want to live. And that has been a core thing. And Andrew Weewell, who is our Assistant Director for Adult Future Options, is very much leading that, and we've got a partnership programme to take that forward. And then equally, we're living and ageing well. So older adults and people living with dementia can live also the life that they want to live and be enabled to live their life. And Joe Pass, who is our Assistant Director for Living and Ageing Well, is leading that piece of work in collaboration with colleagues right across the city and with individuals and carers to go and do that. And finally, we're focused on earlier intervention and prevention. Kelly, who you met earlier today, is very much leading that focus so that we can help, you know, ultimately enable people to live independently well, which is our core focus. And alongside that, Catherine and Liam, who are core clinical and Don, in terms of core assistant directors, very much our commissioning programmes, our governance, and also our focus on workforce as key enablers to making all these areas very much a success. But core to all this is communications, and the reason why I brought Danielle today, because Danielle has been a key colleague I've worked with over the last 3 years. You started pretty much at the same time as me, and actually, you know, we've been bit by bit as working to think about how do we continue to go and develop our communication strategy. Because I think one thing that really struck me to everybody when I spoke to everybody was how do we tell everybody the story? How do we get out there? How do we actually ensure that our social care providers, to the individuals and carers, to all our partners are with us on our journey. And Danielle has been working on not only enhancing some of our communications, but actually what we're going to hopefully bring to March Committee along with my usual DAS update as a communications plan, which I know for members that was one of our key big ambitions in going forward. So that's why I was keen for Danielle to be with us today, and she's, you know, bringing with that enthusiasm how we take that forward, including a big service event and conference over the next year to promote what we do. So that is the update, and I just want to end again with a huge massive thanks to everyone who's been involved in the journey, because each one of the different parts along the programme have all been with our partners across the city and a range of different partners. So thank you.
Thank you. Are there any questions on the report? Councillor Thornton.
Thank you, Chair. I just thank you for this, as it's obviously extremely comprehensive and has been a long time in the making. So thank you for both of your continued work on this. I was just wanting to ask, obviously, as this is in partnership with different providers, how have they engaged in this, and has there been any pushback from any external providers on like frameworks and strategies? Just as we have quite a wide variety of providers that don't always provide the sort of same level of support or interventions as others. So I'm conscious that we don't necessarily go for a one-size-fits-all approach where, you know, organisations have better things to be doing than writing policy for things that they don't do, I suppose. So just wondering how we engage with that, and how providers have been reacting to this process and how we're making sure that their voices are heard.
It's a really good question. And this is the reason why I was keen on the communications, because we're approaching it in 3 different ways. So in terms of home care, one of our key aspects over the last 3 years was for me was to transform our home care provision. So it's very much focused on enablement and outcomes focused practice. And Catherine's talked about it in previous discussions. And the way in which we've worked with providers is we've actually set up a forum for home care providers. And what we actually asked is one of the home care providers to go and co-chair it with us. So it's very much as a collaborative approach. And that's both providers who were successful and unsuccessful in terms of the contract, because ultimately as a DAS, I have responsibility for not only our commission provision, but also our non-commission provision. So for me, it's important that we are working with all providers in the city in a collaborative way. So that's one of the key aspects around home care. And what I see is that forum is a way of not only supporting our home care workforce, but also, leading and working in collaboration to go and implement the new kind of approach we want for home care across the city. And already I've had one provider who's nominated themselves to be my co-chair, which is fantastic. And it's probably helpful to note, as I actually started as an 18-year-old actually as a home carer. So for me, it's very much a key area of focus for me. The second bit is around our adult future options, and actually one of the key pieces of work that Andrew Wewall has been leading, who is our Assistant Director for Adult Future Options, is working with providers, particularly within the supported living and day activities framework that was approved last year at committee, and to work with providers to say, actually, how can we work with you in a really collaborative and different way? So what we've tried to do through, particularly around for people with learning disabilities, is Andrew leading that himself and taking that forward. And as we go into 2024, the reason why I noted that within the target operating model is because actually that's one of our big programmes of activities. And what I have this very straightforward but simple ambition is that we have one voice for adult social care. It's not about, providers or statutory services. It's about how we all work together. And Andrew's actually doing a test of change around that just now. And what the aim is in March is to bring a bit more information about that together to committee. In mental health, we're trying to do the same thing. And again, there's a different set of providers we work with in mental health. And particularly across mental health, we have a range of voluntary sector who we work with, as well as social care kind of providers. And it's really quite a mixed market, I think, more than some of our other areas. So for me, one of the key things has been is actually to work with particularly Synergy, who we heard about at a previous committee about voluntary sector and also social care providers and how we could work differently together. And so that's currently the work that's underway to make this really cohesive and straightforward, because mental health is quite a range of people around that agenda. So for my job card, what we've got just now is making that straightforward so that I have it from a point of view of individuals get the support that they need quickly, ultimately, by having that total collaboration. So we're trying to approach this in different ways, then recognising also the role of the voluntary sector. And actually one of the key things I've noted within the target operating model is we're going to now re-establish our adult partnerships, because as we've now have the new sort of providers on board, as well as new partners across the voluntary sector, for me it's re-establishing that. And we've actually asked one of our colleagues in the voluntary sector to basically work with us to co-design what that looks like, so that very much it's co-designed from the point of view of the sector as well as individuals and carers. So that is underway and to be taken forward as a priority through 2024. So for me, it's recognising that within social care we have about 17,500 of our workforce, so we are as large as SDH when you put us all together. And that's it. So we have a large workforce across private, voluntary sector, community interest companies. We are a large and diverse sector. And one of the key things I think I've learned over the years is to really make sure we're engaging with people, is to try it and work across different thematic areas and make it personalised very much around individuals and carers. So we're conversations around how do we have that team around a person and kind of very much that focus. So hopefully that answers the question.
Thank you. We have some recommendation on page 116. I just want to say thank you to the team for, I think the thing that is really important for Councillor Thornton as is the fact that communication is really important, because change is necessary, because the challenges that we face financially have meant that we have to change the way we work, because we have to deliver better services with less. And the only way we can do that is working together with our partners. So, you know that I hate buzzwords, but when we say co-production, it's like meaningful, working together, listening to each other and communicating well. And that's the thing that I think, you know, we can, as an organisation as a whole, we need to really focus on in terms of how we relate to people. Because when things go wrong, it's always because there's something that has gone wrong in the communication on, you know, either side. So thank you very much for the report. So the recommendations are on page 216. So we are asked to endorse the progress in delivering upon the adult care strategy, endorse the progress in delivering the target operating model, and request that the strategic director of adult health and well-being provides an update in 6 months as part of the DAS and strategy delivery updates. Fiona, you're making notes of this, so all these things I need to go in there as updates in our work plan. So thank you very much. Are people happy with those? Brilliant. So we are on the last item on the agenda, that is item 15, Sheffield Care Sector Workforce Development Strategy 23-26, and it's an update.
Hello, Dawn Bassender, Chief Social Work Officer. So yeah, we're just here with our 6-monthly update, setting out our further investments in our workforce, as Alexis has just said, our 17,500 strong workforce, and setting out further ways in which we're working towards ensuring they feel valued as we do.
Hi everyone, John Chamberlain, Workforce Development Manager in Adults Care and Wellbeing. So I've got the remit around taking forward this piece of work. So really pleased actually to be able to come back to committee and provide an update on the progress we're making against the Workforce Development Strategy. The strategy came to committee in March last year. I think it was the first time we'd developed a strategy which was across our external and internal workforces and across the 17,500 workforce in Sheffield. So really, really important step forward, I think, for Sheffield in terms of supporting our workforce. In the strategy, we recognise the scope of the workforce, so as we say, the volume's 17,500, which is quite a large workforce. Also, we talk about some of the systematic challenges that are facing the workforce as well. So in particular, we know there's high levels of turnover in the workforce. We know recruitment is challenged as well. So about 10% vacancy rates at the moment in Sheffield. And what this strategy does really is just try to set out what actions we will do to try and address some of these systematic and challenges that are across the country really, and what we're going to do. Working in partnership with partners across the ICS and voluntary sector, care providers, etc., to look at how we can take forward work to try and improve conditions and really value the social care workforce in Sheffield. Just to give you a recap in terms of the priorities, so in the strategy, we framed the strategy against 3 key priorities, which were to develop a well-trained and developed workforce, a healthy and supported workforce, and a sustainable and recognised workforce. And then there were 5 key themes which we basically based the strategy under, which is to value and empower the workforce, to create a more representative workforce, increase recruitment, increase retention, and then improve conditions for the care sector. So, really quite a high level, and it cuts across quite a lot of themes with this. So in terms of the report we've brought to you today, so this is the update that from the strategy in March. I'll try to provide a kind of a high level update in terms of some of the key activity that we're taking forward as part of the strategy. The strategy itself is a 3-year strategy, so we're approximately 6 months into that strategy at the moment. So a lot of kind of still work to do in this space. In terms of the engagement approach, it's probably worth noting that we have a workforce engagement board in Sheffield, which is co-chaired by one of the locality manager from Skills for Care, as well as the ICS workforce lead as well. And we've got representation from across care and voluntary sector and further education and academia, really working on that approach of engagement and collaboration to really push forward how we support our workforce in this area. We've also noted in the paper that we'll plan to do some further workshops and engagement work for 2024 and onwards, just to make sure that we're really working together to take forward a lot of the initiatives that we've got in this paper. One of the other key highlights that we flagged in the paper was around our move towards the LJ workforce standards. So these are key standards that are set for social workers and occupational therapists. And it was our intention that we wanted to be really clear that we wanted to set the highest level possible for our workforce, but also how we would support them in this space. There is an audit which is attached as in the appendices in terms of the progress we've made towards that, and it's our ambition that by June later this year that we'll meet all the conditions to be able to do that. So there's some action still that we need to take. In particular, some of the areas that we need to move forward with, and it's something that Councillor Rooney mentioned earlier actually, which was around the implementation of career sector development pathways and training profiles. So that's one of the pieces of work that we're currently on board with. We've made some good progress with our social workers and social care practitioners and our occupational therapists, but our intention is to do this across the entirety of social care, also working with colleagues from across the spectrum to implement national initiatives in this space, which will be coming in place in 2024, which will be the care sector career development pathways. There's also some work for us doing around the embedding of practice leads and some other works, but our intention, as I say, is to achieve those standards later this year. It's also our intention as well to work towards Investors for People accreditation for the internal workforce as well, which again is will be a really high standard and really good value for our workforce, and just show that actually as an organisation and as a sector we really value our workforce moving forward. One of the other notes on here as well is that we're going to launch a celebration and recognition event in 2024 for our health and social care workforce. So that, again, working in partnership with colleagues across the sector, just to really champion and value the workforce. And again, we'll be working in partnership with organisations, with us taking the lead to develop that. One of the other big highlights as part of the report was our proposal to commission a care academy for Sheffield. So the intention around this will be to bring in an off-the-shelf package. We've done some work in terms of market option work to look at how that might work in terms of developing our own care academy, but from doing the market testing, there's suitable options that we can bring in that will be within our kind of financial package that we're looking at. So that will be a free quality learning development offer for all care sector providers in the city. We'll support with our recruitment and retention in the city, and just I think it's a really exciting thing for us to move forward for in the city. Again, really shows how we're valuing and supporting the care sector in Sheffield, and we can use that as a springboard to launch further plans to support with recruitment, retention, and valuing the workforce as well moving forward. There is a note in the paper as well, which is towards our move towards the foundation living wage as well. So just to say that was picked up as part of the Market Sustainability and Commissioning update, which was in the December committee. So the majority of that work is picked up as part of that paper. But I'm aware that members will be interested particularly in that. And lastly, as part of this, in terms of the high level, is just an update in terms of the Being Healthy at Work plan, which we've done some work to engage with the workforce and to update as part of this piece of work. So again, that's just showing how we're going to support the workforce to remain healthy and really improve the well-being of our internal workforce. We do have plans in place to look at how we can expand that to our external workforce and look at the scope of offer for well-being for the care sector as well. But that'll be future plans. So that's our internal workforce for the Being Healthy at Work plan. So that's probably a really high-level summary in terms of what was in the report. Hopefully it shows some of the really positive work that we're looking to do in this space. There are challenges in this space in terms of the social care workforce, but hopefully this outlines how we're trying to meet and address some of those issues.
Any questions? I just want to say thank you, because obviously we looked at this last year in March, and as usual, we're trailblazers in this place, because now we're looking at this kind of thing as a whole kind of workforce for the whole council. and that work has started after we'd already set this up. So it fits in really well, and I'm assuming that you are kind of liaising with what's happening in terms of whole council approach to the workforce, which is brilliant. I was just wondering whether I'm really pleased to see the social care academies in, and I was wondering whether, apart from an off-the-shelf facility, because last year I think we discussed having somewhere where people could learn how to use specific equipment that, you know, that is very specific and very expensive. And I was wondering whether we were still looking at that, or is something we could look at in terms of, you know, like there is some equipment, for example, for moving people. And I know that we have some, you know, fall equipment, quite a lot of fall equipment at the City Alarms site. And I was wondering whether we could create like somewhere where even our providers could train their staff using certain techniques and things that, you know, that would really help, because it's super expensive to get external providers to go to for example, a care home and have that training for the staff. But if the council could offer that service, we could bring some money in and offer it for less money, for example. Councillor Aries.
So add to that, because I mean, not just that, but that was an example that we saw last year on the, and I thought whether that could also be sort of replicated, you know, investigated is probably the word, in different areas. You know, we have a lot of expertise within the workforce that maybe training opportunities and also income generation. I think, you know, that's really what it is, isn't it?
Yeah, so I'll just come in. Yeah, I mean, I think one of the key areas for this in terms of the Social Care Academy actually just gives us a really good framework to put any of these areas of innovation into. So I think it just helps us explain actually a kind of yeah, it just gives us that good foundation to be able to discuss and explain actually what we mean in terms of, you know, supporting and developing the workforce. So what I would say is, in terms of the kind of specific area around, you know, a hub for developing equipment adaptations support, certainly I think it's something that we could come back with and go and explore and come back with. We have talked in particular about how we can support the workforce with their knowledge around tech-enabled care and linking with the tech-enabled care projects, and that would be one of the aims and ambitions that we've got, is, you know, how can we support the workforce around that to be kind of future-proof for, you know, a lot of the technology and a lot of the things that are coming in this space. So yeah, I would say absolutely. I think there's good opportunities there.
Thanks. I keep doing that. Sorry. Thanks, Chair. Thank you. I've got a question, and it's just simply, are people being paid enough? And the Care Academy thing, brilliant, and, you know, our whole sort of localised approach to upskilling and training, I think it's all really good with the Care Academy, and it's like a really localised solution to something that's a big national problem, and hopefully it will make Sheffield a really desirable place to work, and that all looks really right, but my question is definitely, are people being paid enough? And, you know, will upskilling through training lead to like up pay packeting as well? So will people feel financial reward for the extra skills they learn? And you know, can we really get there on pay to make that an attractive part of the package for Sheffield as well?
I think this is a really complex issue, particularly around pay. Obviously, in the strategy, we've made a commitment to going towards the foundation living wage, which I believe Catherine Bunton's coming back with a paper in March to talk about that in a bit more detail. I mean, what I would say is it's a complex issue. There's multiple facets to this about how we look to support and develop the workforce. We talked a bit in this about how we can support the progression of workforce. So we've got an internal package at the moment that where we've got social workers can progress to higher bands and to work with that. As I briefly alluded to in my opening, there's a national programme which is looking at the care sector career development pathways as well, which will be implemented this year as well. Again, the details in terms of how the progression will work in that is to be decided, and that's at a national level. They're looking at that, but we'll certainly be looking at how we can support the workforce to implement those. I think in terms of the Care Academy and some of the wider support that we're looking at, you know, I think the aim is to support the workforce so that they can go on and develop and progress in their careers where they want to. I think part of the issue is we need to explain to people that actually there are good career pathways and actually people can go on and progress. I always use Alexis as a good example of this. He started off as a home care support worker and then now Director of Adult Services in Sheffield. So we've actually developed some marketing campaign materials which Alexis and Dawn have done some filming in one of the rooms around here where we talk about some of the options that are available and talk about the fact that, you know, there is progression in care and actually, you know, it's a worthwhile career choice. So we're doing some work in that space, but as I say, I think it's a complex issue, and I think it's multifaceted, and I think the more we can do to support around the outside and to support carers to support them on the way, that will hopefully help. But I think there's obviously wider issues with this.
One of the additional things when we were looking at the Social Care Academy and looking at getting one ready done, if you like, is that they've already got lots of links to lots of discounts as well. So part of the reward system, that when we heard from one of the people that was using their system, they were really excited about doing the next level of training because they got the next level of rewards then and discounts across all sorts of different places. So I know it's only a small thing, but it all helps, doesn't it? If we can get different discounts and get people excited in training and learning and development, it does lead you up the career ladder as well. So that was a good thing about the academies that we were looking at, or are looking at.
Thank you. I've got Councillor Phipps and Councillor McLean. Could you ask your questions together? I'm just conscious of time and I'm supposed to be in another meeting, funny enough.
Thank you, Chair, and thank you for the report. In the improving retention in adults care section, it talks about the career progression pathways for our social workers that we've just been talking about. I was just wondering if we had seen any feedback around this in the employee surveys that are referenced later in the report, whether it's already being positively or negatively received, or just interested to see what's coming back from those reports.
Thank you. It's just a quick comment. We'll follow on from Councillor Milson's question. I met with a care homeowner and manager in my ward before Christmas, and he was chatting to me. And often, you think about the care workers who need to be paid more. We want them to have a foundation living wage, ideally. But he was talking to me about his frustrations as a manager and how he wants to be able to pay staff more. He wants to be able to sort of reward them when they progress. And I just think it's something it's easy to forget, isn't it? That, it's for him as a care homeowner, he wants to sort of develop his service. And yeah, it's a different sort of side to it as well. But I just thought it was just worth noting, especially as he mentioned it to me quite recently. Thank you.
Yeah, we have had some positive feedback that fed through into the survey around the new progression routes. And we've also had like a couple of quotes that a social worker and a social care practitioner have provided that we're looking at possibly putting in our self-assessment that we're developing as part of our preparation for our inspection visit when CQC come a knocking. So yeah, it's been really good. Lots of really good feedback. And yeah, in relation to the care homeowner, well, hopefully, the Social Care Academy will support them to give them those rewards. Yeah.
Thank you. And also, if we could capture those compliments, that would be a really good thing for our staff, because often the staff will hear when where something goes wrong and people complain, but if we can also support them in terms of, people have come back and said how great the service is, and, you know, they've particularly commented about you. That is a huge boost to people's kind of well-being and, you know, feeling valued in what they do. So I think that would be great if we could do that. So we have 6 recommendations that are on page 256 of the pack. So the committee endorses progress made with implementing the care sector workforce development strategy 23-26. Notes that the care sector workforce strategy workshop session will be organised in 2024 to involve and engage social care providers, voluntary sector and academia in further developing our approach to workforce development, well-being and including agreement of shared workforce standards. Number 3 notes that a Sheffield Adult Workforce Celebration and Recognition event will be launched in 2024 to celebrate good practice and learning. Number 4 notes the intended commissioning strategy for a Sheffield Health and Social Care Academy, endorses the Sheffield City Council Adults Care and Wellbeing Healthy at Work Plan 24-25, and requests that the Strategic Director of Adult Health Care and Wellbeing continues to provide the committee with updates on progress against the strategy on a 6-monthly basis, including updates made based on ongoing learning. Are people happy with that? Great. So this concludes the meeting of today. I just want to say a few things. I forgot to ask officers to introduce themselves at the beginning. So thank you, Alexis. Thank you, Fiona from Democratic Services and Alan doing the tech. But thank you particularly to Sarah. It was our legal advisor on this committee. Sarah is leaving Sheffield City Council, so this is her last meeting. We want to say thank you for all your support, particularly in the pre-meeting when we ask all sorts of technical questions. Sarah's brought some buns or some cakes, whatever they're called. They are over there. And our next meeting is on Wednesday, the 20th of March, 2024 at 10 a.m. Thank you, everybody.